Hey, welcome back to Diabetes Health TV. I'm joined in our booth by Sharon Iliohan. Sharon, thanks for coming by to
Thank you.
say hi to us.
Yes.
What's your specialty in diabetes education?
I was patient education coordinator at the hospital in our community for 20 years, and now I'm at public health, and I do diabetes education, school nurse, and Healthy Start with little children.
So you're jumping around all the time.
I have many hats. I put different hat on all the time.
Which one do you like the most?
Diabetes is my primary, and I've done that for a long time.
But working with kids or the
I've done adults, I've done kids, I've done them all.
What do you like?
I like the children.
Yeah.
Because it's such an important part of a parent's education also, because the parents feel very guilty and think their children have diabetes because of them.
I've seen that. I've had a father, we used to have a diabetes supply store, and he came in and he was just crying, and he said, "Give it to me, I wish I could have the diabetes and not my," you've heard that.
Yes.
That must be, there's the Kubler-Ross stages of acceptance. There's
denial, anger, bargaining. I know them all in nursing school, but I know the acceptance is important.
Yeah. How do you help people accept that? What works?
We go over the information and we try to make the information informative, but yet fun to learn, because these are things that you can't just sit in class and talk about it. You have to do things to let them open up the group and have discussions and talk to others. And I think they kind of get a camaraderie from being around the others in group. They learn a lot.
So do you lead a support group?
Yes, I do. I'm only allowed to do it quarterly now. I was at the Diabetes Center for 4 years, but they closed it because they said there weren't that many diabetics. And I argued to that point.
With an epidemic? There's
very much so, and the nurses on the floors of the hospital do not have time to do that. So that was very disappointing to me, to close the center.
That's a national travesty, because healthcare companies that will pay for amputation, but they're closing the diabetes education centers. It's like, oh my God, what are they smoking? It
and
drives
I've
me
gone
crazy.
From the 16 million to the 21 million. Now that was an indicator to them, but I was the little peon. I'm not in administration, so I was very disheartened when they closed it. So I went looking for another job, and I told them I would like to continue with diabetes information to patients, and they are letting me do that as much as they can.
So you had to pick up different kinds of nursing too?
Yes, I did a lot. Anything that the patients needed in the hospital. If you had an ostomy, a pouch, I did that. If you had a trach, I did that. Anything that the patients need to know as they're walking out the door, which was very difficult.
Right.
Because when they're ready to go home, they're not interested in learning at that moment.
Right.
They want to go home.
Yeah.
So I had many hats there too.
Yeah. Well, that's unfortunate. Someone that's trained in diabetes education has moved into other fields, because there's not enough. I keep hearing there's not enough diabetes educators.
And I'm hoping my position will continue to see that there is a greater need, and they will give me a little more time working in diabetes education.
I hope so.
My goal.
Is there anything that's kind of a trick that you do, or a way that you found to connect with patients that works?
The patients want to keep coming back. Some of them, when we have support group or diabetes information, are you going to have more information? They like to come back to learn new things, so I try to keep up on the new things by coming to AADE, and that has helped.
Right. Do you get our magazine?
I did, but I presently don't. But when I left the hospital, I'd like you to scan me.
So before you go, we'll scan.
Right.
Every diabetes educator is eligible to participate in our box program, where we occasionally can ship a whole box of magazines.
Okay.
That you can pass out in the hospital, put in the waiting room.
Yes. And I still visit the hospital occasionally, but I give it at the health department and set things out when they come in. I still have a lot of people with diabetes.
Has there been anything here at the conference that stands out in your mind that you'd like to share with the educators that maybe couldn't make it?
I sometimes get the DVDs, which I did last year at Los Angeles, and I take them back and listen to them, because I feel this is very important. So if I miss some, I still get the DVDs and listen to them that way. Actually, I was asked to do a talk last week. I had about a 3-day notice to do type 2 in children. And last year we had a lot of tapes on that and things, so that really helped to go back to that.
When's your talk?
I did it. They asked me like 3 days before they wanted it done to 60 people.
Congratulations!
I was
you
really
threw it together.
yes, I did. I can do that now.
What's the solution for type 2 in children?
exercise. In the schools, we don't have enough of that. We're really pushing getting those drinks out of the schools, which in Healthy Start, that is our goal too. We try to get no drinks. They don't need that. But we have a competition with the companies who give money to sports. Banners, signs, and things, which, you know, you're competing against a very large.
Wait, like Coca-Cola?
Yes.
Gives money to the sports teams, and then they get the right
They give banners, they give signs that, you know, for basketball courts, Coca-Cola, Pepsi. So it's hard to compete when you have lots of money.
And my son's doctor says none of those, don't get even juice. He says you drink enough juice, that's like 11 oranges or something.
Yes. I tell a lot of the people to dilute them, especially the smaller children when I work pediatrics, because there's problems with drinking. They start it. Or the mothers who had the drinks in the bottles. They put them in their juice bottle.
Yeah, which is bad for your teeth.
Yes, so then we go into oral care, which I do in Healthy Start, and discuss dental care with the children. And a lot of times it's too late.
Did you get to hear former Governor Huckabee yesterday?
Yes, I did. I bought his book actually yesterday. It's $14 if anyone would like to have that.
He seems like he's on to something. We have to change the whole country.
Yes.
We need a societal change.
Yes, we do.
And are you trying to work on that?
I haven't yet. I'm trying to just go down my booth right now and gain my new information that I may have missed, such as my magazines that I don't get anymore.
Yeah.
So I'm hoping to get that.
Well, Sharon, thanks so much for coming on the show.
You.
It's been great talking to you.